So good morning everyone, and I would like to welcome you all in the world of Unacademy. Basically this world will help you to crack NEET PG exam, and obviously our logo is let's crack NEET PG. Okay, so we are Unacademy, let's crack it, and our logo is let's crack NEET PG. And I am Dr. Anil Sharma basically, and I am an MD pathologist from AIMS Delhi. Okay, so basically I have been teaching over here in Unacademy platform since 2 months. Before that I was teaching at an app and in Delhi itself. Now, to be the family of this Unacademy, I would like to welcome you in this family. And if you want to be the family of this Unacademy app, you need to install Unacademy learning app. And this learning app obviously have one of the best teaching faculties over India, Dr. Jainab Bora, Dr. Pawan Kandhari. So these are some of the doctors which are associated with Unacademy app. So basically they are one of the best in their field. Now you need to be subscribing to our plus or iconic subscription. Okay, so try to, when you want to be the family, you can subscribe to a plus subscription or iconic subscription. Now this both have some facilities. With iconic you are getting prep ladder also. So prep ladder have again very good faculty for teaching. So this you will get video lecture over there, you can get question banks, you can get revision courses, and even handwritten notes of different toppers. Okay, and in plus subscription you can get live classes, quiz and test series, batch courses, and structure schedules. Okay, so these are very important. So I'd like to recommend you, please, you can take iconic subscription which comes with prep ladder. Now what are the charges? So for iconic you can take subscription of 12 months, 18 months, 24 months, and 36 months, and these are the charges which you need to pay. But you can apply a promo code, and like my promo code Anil Live, basically this promo code will be giving you 10% off, and then the charges will be 49,500, which is around 5,500 benefit, that is giving you 4,125 rupees per month. Okay, so in month you are spending 4,125 rupees for number of live lectures every day by good faculty teachers, and again you are getting live lectures from prep ladder also. You can join their question banks, and obviously you can interact with the educators. So one of the very important thing is you can interact with the educators, and that you can get in mere 4,125 rupees per month. Now you will also have plus subscription, which can be subscribed as 1 month, 3 months, 6 months, 12 months, 18 months, 24, 36 months, and these are the price. With again applying the promo code Anil Live, just you can get a discount of around 4,000 rupees in when you subscribe for 12 months. Okay, so this is again very important, and you can apply this code Anil Live, my code over here, and you can get 10% discount and in your NEET PG subscription. Now we were doing about kidney structures and diseases related to kidney, and basically first thing we'll start with glomerulus. So today basically I'll teach about the basic concept of glomerulus and all. Yesterday we had done some basic concepts about glomerulus. Today we'll start again, we will do continue our basic concepts, and also today images of different IF and basically electron microscope. Okay, so immunofluorescence and electron microscope images which you can be asked in your exam. So when you talk about IF, IF, then you should be knowing that IF basically involves two basic organs, that is kidney. Okay, we'll talk about kidney and skin. So in IF we need to know the IF finding of the kidney diseases and skin diseases. So these are the two very important organs where immunofluorescence is used. So we'll talk about kidney here, then obviously in skin and kidney both I'll combine in one of the special class which I'll be taking very soon, so that you can complete IF with these two classes. Okay, now coming to the glomerulus, we were talking about glomerulus, and I had talked about yesterday, we talked about that. So glomerulus basically is nothing but the PCT when it basically reflects back and forms Bowman's capsule. So there are some of afferent arterioles which are forming the capillary loops. Okay, so they are forming the capillary loops, and these capillary loops basically again combine together and form the efferent arterioles. So these are the afferent arterioles, and these are the efferent arterioles. Okay, these are the efferent arterioles. Now basically we had also done that this capillary loop. Okay, so this capillary loop is basically known as glomerulus. Okay, so they are in lobules, so they will be in lobules. अलग अलग lobules में होता है, so they are in lobules. So here you have lobules, here you have lobules. So these lobules, and each lobules have different amount of number of capillary loops. Okay, so we are coming with two poles of this glomerulus. One basically you are getting the vascular pole, and one you are getting the urinary pole. Okay, so basically this vascular pole have glomerulus which float in it. Okay, which float in this vascular pole. So basically glomerulus, it consists of capillary tuft which are anchored at the vascular pole and floats in the Bowman's capsule. Now cellular components which include, so now yesterday we had also talked about these cellular components, like this is suppose capillary loop. Okay, so this capillary loop have, these are the endothelial cells. Okay, this basically is the basement membrane. These are the endothelial cells. Okay, endothelial cells, these are the basement membrane, and over here outside there will be food process of podocytes. So we have talked about this food process of podocytes, we have talked about the endothelial cells, we have talked about the basement membrane, and obviously here we will be getting some of the, here we will be getting mesangial cells. Okay, so we will be getting mesangial cells. So we have talked about this also yesterday. Okay, image basis also we have seen. So basically this hence glomerulus is made by endothelial cells, mesangial cells, podocytes, and parietal epithelial cells. So parietal epithelial cells are nothing but they are this parietal epithelium of Bowman's capsule, that is reflection. Parietal epithelium is reflection of PCT. Okay, so these cells over here in the parietal epithelium, they are known as parietal epithelial cells. Basically the podocytes, or they are also called as visceral epithelial cells. Okay, podocytes or visceral epithelial cells are they are called visceral epithelial cell also. So they are called visceral epithelial cell. Now extracellular matrix, mesangial matrix, GBM, and Bowman's capsule. So these are some of the parts which are forming a complete glomerulus. Okay, so now we also talked about that glomerulus filtration barrier. So now as I said, obviously when I'm talking about glomeruli, so suppose this is a glomeruli, so this glomeruli will have endothelial cells. Endothelial cells will have fenestration. Yesterday I talked about fenestration. So fenestration, that will be about 70 nanometer. Okay, 70 to 120 nanometer. So this fenestration along with the endothelial cells forms the first barrier for any kind of, so this is a capillary loop. Here it will be blood, and for obviously from this blood you need to take out all the essential part. You need to filter, all filtration takes place here over here. Okay, so the first filtration barrier over here is the endothelial cells of the capillary loop. Okay, in the glomerulus. So that in very much important thing you need to know. Then you have GBM. Okay, this is the glomerulus basement membrane. Then you have the slit diaphragm and subpodocyte spaces. Okay, so we have talked about this thing also yesterday. Now coming to the endothelial cells. So what does this endothelial cells? So the endothelial cells, now what do you need to know about endothelial cells? I have already explained that these are the there will be fenestration about 70 to 100 nanometer in diameter. I had also I also talked about yesterday that there will be polyanionic glycoproteins over there. Okay, like polyanionic glycoproteins, just like podocalcines. Okay, so this podocalcine, what this podocalcine will do? So they will impart negative charge. Okay, so negative charge. So negative charge, hence the negative charge albumins or negative charge proteins, what they will do? They will be repelled back. Okay, they will be repelled. Okay, so basically hence the negative charge proteins, they can't pass through this endothelial cells or through this basement membrane. Okay, so that is important. So basically this restrict filtration of the plasma molecule, very much important. So this negative charge is, so one is gradient. As I said yesterday, there will be this, suppose this is a glomeruli, and this glomeruli will have endothelial cells. So there will be fenestration over here, fenestration over here. Then what you need to know about here is this fenestration. Then there will be basement membrane, and there are basically filtration slits. So the filtration slits are basically, this filtration slits are basically around 20 nanometer. This is around 70 nanometer. So a gradient is made. Okay, so one is this gradient is helping for filtration. Okay, another the negative charge which is mediated by the polycalcine negative charge glycoproteins. So these are helping for the negative charge. So these two important things which are helping for the filtration of any proteins through the basement membrane. Okay, so that is again important, which is so another important function of endothelial cells is that this secretes molecules which are involved in immune response. Okay, as I said, endothelial cell will secrete the molecules, or it will be providing the immune response. Okay, whenever a foreign materials comes into the kidney, so the immune T cells or B cells activation or immune response is given by the endothelial cells. Okay, so endothelial cells are responsible for giving immune response, and as I said yesterday, mesangial cells are responsible for stopping those immune response. Okay, whenever there is high amount of immune response which can result into autoimmune disorders, so those immune response are controlled by mesangial cells. Okay, so now you need to know function, these two important function. Okay, then another important function is basically, now since they are responsible for immune response, how they will respond. So these endothelial cells act as antigen presenting cells, so they will express MHC class 2 molecule. Okay, so now just by this in the thing, or when we talk about the pathophysiology of how these immune complexes are acting, so basically fixed immune complex and circulating immune complex, how they are resulting into this different glomerulonephritis syndrome. So when we talk about that, then you need to just go back to your concept, go back to the concept of your immunology. Okay, so the immunology, so basic pathology, don't forget basic pathology, just integrate your basic pathology whenever you study any type of concept. Now when I'm talking about the immune complex, when I'm talking about MHC class 2, so now you should just go back and एक बार MHC molecules, so what MHC, different MHC types of MHC, just MHC class 1, class 2, okay, class 3 and even class 4 we say. Okay, so just try to रिकैप्चुलेट दैट. ओके, उस चीज़ को एमएचसी के बारे में फिर से एक बार जाके अपने जनरल पैथोलॉजी खोल लो. जस्ट गो ओपन योर जनरल पैथोलॉजी. ऑब्वियसली यू विल गेट to know different types of MHC class 1, MHC class 2. MHC class 1 what will react with MHC class 1. Okay, class 1 will be reacting with CD8, okay, and class 2 with CD4, so that you should know. And what are the component of MHC class 1 and what are the component of MHC class 2. So just recapitulate that, go into your general path and just recapitulate MHC class 1 and class 2 now at least. Okay, so basically where will be MHC class 1 found? Okay, all the nucleated cells except which cell? So except all the nucleated cell will have MHC class 1 except basically your RBC. Okay, nucleated RBC doesn't have MHC class 1. So now these are some of the important one liners you can get, or important thing concept अगर आपको clear करना है, just you can go back to your general path. Okay, that is very important. आप integrate करो. What I say, just don't leave anything like this. MHC class 2 आया है, so just you need to just revise that, go back and revise that. In 2 minutes you can revise your, and again if you are doing same thing, repetition is very important. Revision. Okay, that is only the one way where you can get quick success. ठीक है, time दो, revise करो. ठीक है. So now mesangial cell, as I've already talked about mesangial cells. So mesangial cells are basically, they are 1 to 2 nuclei. So basically, as I said, we have talked about, I'll show you image also. Now what are the mesangial cells? So they are responsible for matrix production. Okay, they are responsible for matrix production and they control the immune responses, that is the phagocyte property. So they have the phagocytic property for degradation of the immune complexes, very important. Okay, and these mesangial cells, again they have smooth muscle properties, that is again very important, the smooth muscle property, and hence they are responsible for contraction. Okay, contraction, contractile property they have got. Okay, so that is again very much important in case of mesangial cell. You need to know this function of mesangial cells and endothelial cell, because now when the question is set in as for INICT के लिए, अब जब आप question set करोगे, basically the examiner will try to test you in the function of this endothelial cell and mesangial cells. Okay, so which of the following is true about the glomerulus, they will ask. Okay, which of the following is true about glomerulus? Okay, then obviously what can you get? So you will get that endothelial cells are responsible for endothelial cells phagocyte immunogenic cells. So this can be your one of the option. Okay, immunogenic cell. Another option can be your mesangial cells generate immune cells. Okay, then and third option they can give you in acute streptococcal glomerulonephritis, okay, post streptococcal glomerulonephritis, subepithelial deposits are one of the most common finding of electron microscope. So they can give any other two options, okay. So now you need to know, if you don't know the function of endothelial cells and mesangial cells, you are confused. So obviously more than one options can also be right. So now it's very difficult. Option 3 is right, okay. This is right. So okay, you will think that okay, I did this answer correctly, but you missed one thing, you missed something, okay. So you missed something because there can be, the option can be like endothelial cells, they are responsible for producing immune response. So now you will not tick this if you don't know about the endothelial and mesangial cells, okay. So you need to know the function of endothelial and mesangial cell, very much important. Yesterday also I said about this. Then you have podocytes or visceral epithelial cells, okay. So they are the specialized cells. They, as I said yesterday, they have large bodies, and obviously they have multiple arborizing cell, elongated cells process, which is known as food process. So they have a cell body, they have a food process, okay, and they are basically responsible for your filtration barrier, okay. They are responsible for your glomerular basement membrane formation, okay. So they basically participate in GBM formation. They are responsible for your glomerulus filtration barrier, okay, and obviously help in maintaining hydraulic regulation of capillary loop diameters, very much important, okay. So this is the important thing. And as I said, the filtration space is between 20 to 30 nanometer. So this space is very lesser than the fenestrations of endothelial cells, endothelial fenestration slits, which is around 70 to 100 nanometer, okay. So because of this 70 to 100 nanometer and 20 to 30 nanometer, a filtration gradient is formed, okay. So gradient is formed. So this again, this is the structure of a glomerulus. So what is, we have talked about these structures yesterday also. So this is basically your Bowman's capsule, and this is your parietal epithelial cells within the Bowman's capsule. These are the capillary loops. So these are the capillary loops, okay. These are the capillary loops. So these are the capillary loops, and these capillary loops have all these fenestrated things. So they are the endothelial fenestrations, okay, endothelial fenestrations. So fenestration in endothelium. So these all are the fenestration endothelium. Now this is your podocytes, and this is basically, these are the food processes. All these on the capillary loop, these are the food processes, okay. So these are the food processes, and this is your endothelial cells, okay. This is your endothelial cells, which is forming fenestrations here, fenestration, and these all are the podocytes. This is basically a visceral epithelium, or what I call it, podocyte, okay. So these are very much important part of a glomerulus. Now you know basically, now when I talk about some disease like post streptococcal glomerulonephritis, you should know that this is basically your intracapillary, okay. So this is basically your intracapillary, cellulary is intercapillary and intracapillary. So this is basically your intracapillary, and this space is mesangial space. The cellularity will be increasing over here, over this place, and if in Crescentic glomerulonephritis, the cellularity will be increasing over here. So now basically you, with this explanation, you know very well that obviously when I talk about intracapillary hypercellularity, which yesterday I talked about when we talk about glomerulonephritis, I am telling about you the cellularity of mesangial cells, and obviously mesangial region and intercapillary endothelial region. But when I talk about Crescentic glomerulonephritis, I am just trying to tell you that there is cellularity outside the capillaries. Obviously then there is involvement of this parietal epithelial cells, okay. There is involvement of parietal epithelial cells. So now that is important thing which you need to understand here. Now coming back to another electron microscope. So basically yesterday I didn't I didn't tell you about this structure. So when you see electron microscope, okay, so basically when you see electron microscope, what you need to know is the electron microscope will show the capillary loops. So these all are the capillary loops, okay. Wherever this is a capillary loop, this is a capillary loop, this is a capillary loop. So these all are the capillary loop you can see. And this capillary loop have, what does this capillary loop have? This is the basement membrane, okay. This is the basement membrane. This is a complete basement membrane, and just outside the basement membrane, these all are the food processes which are, and the spaces between these food processes are known as filtration slits, okay. These are all the food processes which are forming filtration slit, okay. And obviously as I said, basement membrane, so the region inside the basement membrane will be these all are the endothelial cells, the inside the basement membrane or towards the capillary loop. So this is the blood, RBC and RBC, this is an RBC, and obviously these are the endothelial cells, these are the endothelial cells. So here you have endothelial cells, these are the endothelial. So this is an endothelial cell, and obviously this again, this inside there are endothelial cell. This is the basement membrane, and this is a mesengium. Okay, this is a mesengium. Now this is a mesengium. So this is a mesengium and mesangial cell. Okay, that you need to know, mesangial cells. Okay, so these are important thing which you need to know in case of a electron microscope. When you see electron microscope, you need to know this. Now obviously this picture is showing a filtration slit. So this is a basement membrane. As I said, basement membrane. So basement membrane we divided into three parts. So this electron microscope shows very beautiful basement membrane. So this part is basically your densa, laminar densa. So this is your laminar densa. Okay, by name itself you know, because density is high. So the outer part basically it is known as lamina rara externa. So basically by name itself you know that is external part, and lamina rara interna. So this is lamina rara interna, lamina rara interna. So you know very well this also. So now basically these three parts, lamina rara externa, lamina rara interna, and lamina densa. So these are three parts of a basement membrane, and the inner part, that is interna part, will have endothelial cells. So this is endothelial cells, and the external part will have podocytes, food process. So these are the food process of podocyte. These are the food process of podocytes, and in between them these are the filtration slits. So these are the filtration slits. The space between them are filtration slits. So these all are the filtration slits. Okay, so this you need to know very well. And now again this is electron microscope only. So what is this electron microscope is showing? So this electron microscope, it is showing that this is a basement membrane. So this is a glomerular basement membrane. Okay, so this basically is the capillary loop, and then this obviously capillary loop will have RBC. So these are the red blood cells, and red blood cell will have RBC, and these are the food processes. These are the food processes, and obviously outside region there will be podocytes. So these are the podocytic cells or visceral cells, and this is basically parietal epithelial cells, or as I said, this is a Bowman's capsule. Okay, this is a Bowman's capsule, and the inside this is the mesangial region. So this is the mesangium. So we have talked about this again yesterday also, basically in our classes, and this is basically today I am talking about the इलेक्ट्रॉन माइक्रोस्कोप में आपको क्या देखना है, व्हाट ऑल यू विल सी इन एन इलेक्ट्रॉन माइक्रोस्कोप. ठीक है, सो बेसिकली इन इलेक्ट्रॉन माइक्रोस्कोप व्हाट ऑल यू विल सी, you can see एक basement membrane दिख रहा है. Okay, here you can see basement membrane, and this basement membrane basically have RBC. So this is the capillary loop, and obviously there are the food processes, and these are the podocytic cells. Okay, so this all you will see. So now basically whenever there is a EM picture, basically don't skip that. हो सकता है you might not be asked in exam, but why you need to know is आपको ये concept समझने के लिए. ठीक है, when I say subepithelial deposition, or when I say subendothelial deposition, or when I say podocyte, or in the electron microscope and effacement of podocyte, then just try to see this podocytes. Okay, ये podocyte food processes है, इनका कहीं पे effacement हो रहा है, कहीं पे ये they are going, or see here. So यहाँ पे ये होना चाहिए. यहाँ पे basically you don't see any kind of podocyte. So हो सकता है यहाँ पे effacement हो रखा है. Okay, so that you need to know food process of podocyte. So this basically you need to see all these things properly. अगर कोई बोला हुआ है वहाँ पे तो, because images what happen they are stuck in your mind. Okay, वो images you make a picture, and whenever anything किसी भी चीज़ का picture बना के पढ़ते हो, that becomes easy to understand. ठीक है, so basically for that I am teaching you again and again. So basically when I talk about basement membrane, so basement membrane is produced by collagen type 4. Okay, there is laminin. Okay, there is nidogens, there are heparan sulfate proteoglycans. Okay, proteoglycans, and the major proteoglycan which is forming a basement membrane is agrine. Okay, so the major proteoglycans forming a basement membrane is agrine. Again, this is a MCQ question. So which of the following is the major proteoglycans which forms basement membrane? That is agrine. Okay, so again this picture is showing this is capillary loop. Obviously these are the mesangial matrix and mesangial cells, and here you have basically here you have what you call it endothelial cells. This you have the podocytes. Okay, so basically when I see this picture again in large, I have already talked about that there will be in the glomerular basement membrane, there will be lamina densa, there will be lamina interna, there will be lamina rara externa. We have talked about this. These are the podocytes, these are the endothelial cells. So we have talked about all these things in our previous classes also, and again I am teaching you again this image अच्छी तरह से याद रखो. This becomes very easy to understand, ठीक है. And yesterday again I've talked about that whenever this basement membrane, it will have podocytes, and these podocytes, two podocytes, they are connected with nephrin molecule. This nephrin molecule is connected with the food process of podocyte by podocin, okay, this podocin, okay, and CD2AP, and obviously they will be connected with actin filaments. So these are, there will be an mutation in all these, and they can result into different type of glomerulonephritis, different type of diseases related to kidney. We'll talk about those mutations also in subsequent classes, okay. So then again, this is again cartoon picture which is showing. So this is a basement membrane, and these are the podocytic processes, food processes, and if anything deposits under them, okay, between them, that is known as subepithelial deposition, and we see towards the endothelium, it is subendothelial deposition, to into the membranous, that is intramembranous deposition, and in the mesangial region, it is known as mesangial deposition, okay. So that you should know about electron microscope, okay. So then basically now your picture you are clear about the glomerulus, what are the basic structure of glomerulus. So when your concept about glomerulus is clear, now whenever I tell you about the capillary, so you should know that I am talking about the capillary loop, each capillary loop which these afferent arterioles are forming. When I talk about the mesangial region, I am talking about those mesangium or mesangial cells which are giving the structural stability to the glomerulus. I am talking about those cells. And whenever I talk about podocytes, you should know that where in which region you can see podocyte, and whenever visceral epithelial cell, and whenever I talk about parietal cells, you need to know that I am talking about those Bowman's capsule cells which you need to know, okay. Now when I talk about glomerulus disease, so basically first let's be friendly with these different types of diseases of glomeruli, okay. Then I'll talk about we have talked about IF also. I'll talk again about IF. I'll say, so firstly we should be familiar with this glomerular disease. So glomerular disease आखिर है क्या? So basically when I talk about glomerular disease, what I should know is, I should know that there are two types. One is primary glomerulonephritis and another is secondary glomerulonephritis, okay. So whenever I talk about MPGN, I talk about primary membranoproliferative glomerulonephritis, and I talk about secondary membranoproliferative glomerulonephritis, okay. So this secondary membranoproliferative glomerulonephritis is why secondary glomerulonephritis. So now secondary glomerular diseases, because as I said, basically most of this glomerular disease, their pathophysiology, we'll talk about pathophysiology also, their pathophysiology is related to autoimmune diseases, or they're basically related to the immune system, okay. And when whichever thing is related with immune system, it will show its manifestation at different regions. Like SLE is an autoimmune disease, rheumatic arthritis is an autoimmune disease, and even nowadays diabetes mellitus, they say this is an autoimmune disease, okay. Diabetes mellitus also it is also showing its immune responses. So this all SLE, collagen vascular disease, diabetes mellitus, okay, metabolic diseases, hereditary conditions, so these all are secondary causes of, so these all are autoimmune diseases, and these autoimmune diseases have a characteristic features that they involves multiple organs. So basically because SLE also involves multiple organs, okay, SLE will in lot of involvement, different organ it will involve, and kidney is one of those organ, okay. Kidney is one of those organ which involved by SLE, okay. So we know diagnostic criteria also of SLE. So in that diagnostic criteria also, it has hematological criteria, it has neurological criteria, it has basically nephrological criteria. So basically kidney is one of the organ which is involved by these diseases. Hence this all different autoimmune disorders which you can see, they are basically the secondary causes, okay. So basically, and some of the viral diseases like HIV, hepatitis B and hepatitis C. So these are the three important viral diseases which you need to know, because they are also responsible associated with this immune system. So these three diseases, again HIV, HCV and HBC, are again very much important when we talk about each glomerulonephritis, okay. So because that again, that is the these three things are basically main points where questions are formed, okay. Even this time in INICT, which of the following is associated with HIV. So they were there, or MPGN is associated with which of the following. So they had asked such question. Okay, so basically HIV, HCV and HBV, hepatitis B virus. So these are the three very important reason where you get questions, okay, where they ask questions regarding glomerular disease. So hence that's why secondary glomerular disease are also important. So we'll talk about primary glomerular disease. So primary means it is the main origin of the, or the predominant organ or origin of the disease is basically kidney disease, and obviously it is at the region of kidney. Okay, so that is primary glomerulonephritis. And secondary is the origin of disease is somewhere other place. Okay, it is associated with some other diseases, and that disease like SLE is the origin of disease is because of autoimmune disorders, and that is causing some lupus nephritis. Okay, so that is, so when I say again, I should know that there is primary glomerulonephritis. Okay, there are systemic diseases associated with glomerular diseases, secondary glomerulonephritis, and there are some of the hereditary disorders. Okay, so remember, primary glomerulonephritis are basically like acute, they can again be proliferative and non-proliferative type. Okay, so basically this acute these are proliferative glomerulonephritis. So these are proliferative glomerulonephritis. Acute, even rapidly progressive is also proliferative glomerulonephritis, and it is also known as Crescentic glomerulonephritis. Now this membranous nephropathy, it is a non-proliferative glomerulonephritis. Minimal change disease is a non-proliferative glomerulonephritis. Focal segmental glomerulosclerosis is again non-proliferative. So these are non-proliferative. This is a proliferative. This is proliferative. Again, membranous glomerulonephritis, dense deposit, and IgA nephropathy. These all are proliferative glomerulonephritis. But these all are basically your primary glomerulonephritis. So this all comes under primary glomerulonephritis, but they again can be divided into proliferative and non-proliferative. Okay, so this 1, 2, 3, these all are proliferative, and this membranous nephropathy, minimal change disease, and focal segmental glomerulosclerosis, they are non-proliferative. So you need to know about these diseases. Okay, this classification is very much important. Now coming to the second thing, so here you have rapidly progressive glomerulonephritis. Okay, RPGN. So this nowadays it is called Crescentic. So this it is called Crescentic glomerulonephritis. As I said yesterday in my classification, that basically when you approach kidney, when you read kidney, whenever you talk about the glomerular disease, read in this way, that you first see the hypercellularity. So whether the hypercellularity is intracapillary or extracapillary. Okay, so this Crescentic is basically your hypercellularity is extracapillary. And just now, as I said in the image, I said that extracapillary is basically related with your पैराइटल एपिथेलियल सेल्स. ओके, तो पैराइटल एपिथेलियल सेल्स जो कि बाउमेन्स कैप्सूल में होते हैं, पैराइटल एपिथेलियम में होता है. ठीक है, सो बेसिकली दिस इज एसोसिएटेड, द एक्स्ट्रा कैपिलरी hypercellularity is associated with your basically parietal epithelial cells. Okay, so this crescent rapidly proliferative glomerulonephritis or crescentic glomerulonephritis, this is again divided into three parts that I say, that is type 1 and type 2 and type 3. Okay, so type 2 and type 3. So these are the basic type of glomerulonephritis. Rapidly again, this is type 1 is basically more than that of this light microscopy. They are based on IF finding. Okay, they are based on IF finding. So here if you have a linear deposition, okay, you have linear deposition of basically linear deposition of IgG and C3, that is linear deposition in the IF. This is also called anti-GBM. Okay, this is anti-GBM. And then type 2 are basically immune complex deposition or granular deposition. Okay, there will be granular coarse deposition. So granular coarse deposition, all those diseases yesterday which we talked about IF, all those diseases like post-streptococcal glomerulonephritis, okay, then basically granular deposition, IgA nephropathy, these all are basically type 2. Then type 3 is basically non-immunogenic. Type 3 is basically non-immunogenic. So immunofluorescence or IF is negative, non-immunogenic, and they are basically your ANCA positive. ANCA positive, most of the ANCA positive diseases, most of the ANCA positive glomerulonephritis like ANCA positive. So now when you say about ANCA positive, now ANCA positive, now if they are presenting with systemic vasculitis, so they can present with systemic vasculitis and they can present without systemic vasculitis. So when I talk about systemic vasculitis, so they are associated like microscopic cholangitis. Okay, microscopic cholangitis. Then I say granulomatous cholangitis. ठीक है। सो ग्रेनुलोमेटस पोलेंजाइटिस में क्या आएगा, वैगनर्स सिंड्रोम, ओके, सो वैगनर्स सिंड्रोम आता है। देन ईसनोफिलिक ग्रेनुलोमेटस पोलेंजाइटिस, eosinophilic granulomatous polengitis. This eosinophilic granulomatous polengitis is like Churg-Strauss syndrome, okay, this is Churg-Strauss syndrome. So now see, with one name only you know that ANCA positives are mostly microscopic polengitis, granulomatous polengitis, that is Wagner's granulomatosis, and eosinophilic granulomatous polengitis, that is Churg-Strauss glomerulonephritis, okay. So this you need to know about rapid progressive glomerulonephritis. Then you have minimal change diseases, okay, this you know very well, focal segmental glomerulosclerosis. Then you have membranoproliferative glomerulitis. Now this membranoproliferative glomerulonephritis, they can again be, so here I am completing all the classifications, okay. So MPGN, so they can again be MPGN type 1, MPGN type 2 and MPGN type 3, okay. MPGN type 3, I classify again them like MPGN type 1, type 2, type 3, okay. But nowadays what this type 2, basically it is going towards C3 glomerulopathy, okay, C3 glomerulopathy and C3 glomerulonephritis, okay. And mostly this type 3 is called as, basically type 3 is called as dense deposit disease, okay, so dense deposit disease. So now how do you remember this? Just you remember in a simple way. What you remember is basically there is MPGN, okay, so just keep this MPGN as type 1, 2 and 3, and just try to remember another entity, that is C3 glomerulonephritis, ठीक है, C3 glomerulopathy, okay, and basically remember dense deposit disease, which also comes under the C3 glomerulonephritis. So you can remember this way, okay. Then you have, so this dense deposit disease, this is basically they are C3 glomerulopathy, okay, C3 glomerulopathy, which is like MPGN type 2. Then you have IgA nephropathy. So these are the primary glomerulonephritis, and I will talk about this yeast disease. Yesterday also when in IF finding I talked about yeast diseases. So then you have a secondary causes like SLE, diabetes mellitus, amyloidosis, Good's-Pasteur syndrome. So Good's-Pasteur syndrome, basically it comes under this rapidly crescentic glomerulonephritis with vasculitis, okay. If it is without vasculitis, then that is basically your anti-GBM, we call it anti-GBM disease, okay, we call it anti-GBM disease. Then you have microscopic polyarthritis, granulomatous with cholangitis, and Henoch-Schlein purpura, okay. So these are again secondary causes of glomerular disease also. Now the hereditary disorders like Alport syndrome, thin basement membrane nephropathy, and Fabry's disease, these three are basically most important hereditary disorders which are associated with glomerulonephritis. So this is basically the way you classify glomerulonephritis. These all are the diseases which you will talk about in glomerulonephritis. So we will talk about each disease in next subsequent classes, but today we'll just see about the images of these diseases, the IF and EM of all these diseases, which is very much important from the examination point of view. Okay, so this is basically your, as I said, classification of MPGN. So this is type 1, type 2 and type 3, okay. So basically, and C3 glomerulopathy, where is C3 is the dependent. So this basically it is called C3 glomerulopathy, or why MPGN have been done this way, because MPGN में basically the maximum जो deposition होता है that is of C3, okay, and immunoglobulins are very deposited in very less amount. So those where is completely सिर्फ C3 deposit हो जाता है with very less immunogen, so we call it dense deposit disease. With non-immunoglobulin mediated only C3 dominant, we call it C3 glomerulopathy, and also associated with nephritis and all, we call it glomerulonephritis, okay. So that is important in case of this division. So yesterday we had talked about this IF finding, which we see now you know the name of diseases, okay. Now basically, as I said yesterday, I had made a table regarding the IF finding. So when we talk about IF finding, so you can just see IF can be on or deposition or in immunofluorescent deposition. Dense deposits can be seen on linear capillary wall or in granular mesangial region or in granular capillary wall. Okay, granular capillary wall usually with mesangial, and diffuse mesangial and capillary wall. Okay, so these are basically 4 places where you can see depositions, and yesterday I said just remember this mnemonics: DAD is MLA, where important ones are already covered. So this DAD is for your linear capillary wall fluorescence. So basically this D is basically your dense deposit disease, this A is basically your anti-GBM disease, this D is again your diabetic nephropathy. Okay, and when I am talking about deposition, D for deposition of monoclonal immunoglobulin. Okay, so monoclonal immunoglobulin deposition. So this is important thing you need to understand. Okay, so now this is DAD. So DAD is very fine. So basically DAD is rarely fibrillary, can also show linear capillary wall fluorescence, but DAD part is important. So diabetic nephropathy, dense deposit disease, anti-GBM disease, this is important, and this mnemonics is covering the important ones. Okay, then this is for IS is for your granular mesangial cells, where I is for IgA nephropathy, S is for your SLE, that is class 2 lupus. Now this is MCQ. Okay, so in the lupus, when you talk about lupus, so S is for systemic lupus, and basically class 2 is for granular mesangial. Okay, and class 3 and class 4, so class 3 and class 4 is for your granular coarse granular capillary wall. Okay, so that is important. So now this is for granular mesangial. So except this IgA nephropathy and class 2 lupus, there can be like C1q nephropathy, okay, or IgM in idiopathic nephrotic syndrome or other mesangial-proliferative glomerulonephritis. But important are this IgA nephropathy and WHO class 2 that you need to remember. Now is MLA. So for MLA, now this third thing, MLA, basically this MLA, what you need to remember is granular capillary wall. So this granular capillary wall usually with mesangials will show M and L. So this again will be divided into 2 parts. One is fine granular, which you see in membranous glomerulonephritis, and coarse granular, which you can see in membranoproliferative glomerulonephritis and lupus. Okay, L is for lupus 3 and 4. Okay, now in capillary granular or granular capillary wall, what you need to know is you need to remember one thing, that is scattered coarse granular, which you see in post-streptococcal glomerulonephritis. And this is scattered coarse granular which you see in post-streptococcal glomerulonephritis. Because of this only you can see a lumpy, bumpy type of immunofluorescent deposit in post-streptococcal glomerulonephritis. Yes, or garland, forming garland. Okay, so that is important. Now another is diffuse. So diffuse is you are remaining A is for amyloidosis. So you can see diffuse in amyloidosis. Along with amyloidosis, febrile glomerulonephritis and monoclonal immunoglobulin deposition disease can also have diffuse mesangial and capillary wall deposition. But obviously this mnemonics is covering your important ones, and if you remember this much, then others you can easily say. So with this mnemonics you can remember this table very easily, and if you know this table, your IF in kidney disease is completed. You don't need to know any other things except this. If you know this much, immunofluorescence in kidney disease is over. You don't need to remember other things. Okay, so that is again very much important. So this is basically, this table is showing now important type of immunoglobulins which you see in which deposits in different types of disease. Okay, so I'll come to this table again after some time. So now what you know is basically I said that there is linear capillary wall fluorescence, and linear capillary wall fluorescence is DAD. Okay, so DAD is basically diabetic nephropathy, dense deposit diseases, anti-GBM diseases, and monoclonal immunoglobulin disease. Okay, and that can be also fibrillary disease. So now what happened? So basically in anti-GBM there will be deposition of IgG and C3. Okay, anti-GBM there will be deposition of IgG and C3. In monoclonal immunoglobulin deposition there will be deposition of IgG, C3 and kappa light chain particles. Okay, in diabetic nephropathy there will be mostly immunofluorescence of IgG and albumin, and in dense deposit there will be, we know very well dense deposit. Now by classification we have already classified dense deposit as C3 dominant. Okay, C3 glomerulopathy. So basically there will be deposition of C3, maximally deposition of C3. Okay, so this you need to know. Now what you need to know next thing is that, see here in anti-GBM also there is IgG and C3 deposition, and basically IgG deposition is occurring in anti-GBM also, and IgG deposition is occurring in diabetic nephropathy also. But so what you need to know, you need to do C3 also, and basically C3 or albumin deposition also you need to see, or you need to test. So in diabetic nephropathy there will be IgG and albumin deposition, and in anti-GBM there will be IgG and C3 deposition. Okay, so that you need to know very well in case of linear capillary wall fluorescence. Okay, after linear capillary wall fluorescence you do electron microscopy. So electron microscopy, again electron microscopy we need to know about electron microscopy. I'll just talk about this when I finish this. So then obviously granular capillary wall, we divided into it fine granular and coarse granular. So granular capillary wall was ML. Okay, so MLA, so ML part of MLA is granular capillary wall, where M is membranous glomerulonephritis. Okay, and coarse glomerulonephritis, membranous membranoproliferative glomerulonephritis, and lupus type 3 and type 4, and basically scattered type of granular seen in post-streptococcal glomerulonephritis. So these are the important types which you see and which I have classified again and again, okay, in electron microscope. So now we'll just see one more thing, that is basically sorry, I'll add one slide here. So now what do we have? So we have done already IF. So now we are left with EM. So EM. So as I said, EM can be, so EM can have subepithelial deposits. Okay, EM can have subepithelial. So by now we know very well electron microscope can have subepithelial deposition, subendothelial deposition, intramembranous deposition, mesangial deposition, or basically all, that is subepithelial, subendothelial, intramembranous and mesangial, all type of deposition. Okay, so this basically you can see in case of EM, electron microscope. So coming to the subepithelial deposition, so the first one is subepithelial deposition. So when I talk about subepithelial deposition, so in subepithelial deposition, so you need to know three important diseases, that is one is membranous glomerulonephritis or nephropathy. So one you need to know membranous glomerulonephritis. Another subepithelial you need to know post-infectious glomerulonephritis, or what you call it post-streptococcal glomerulonephritis. You need to know this, that is subepithelial deposition. Okay, then very important is lupus. Okay, lupus class 5. You need to remember this, lupus class 5 as subepithelial deposition in basically in case of electron microscope. Okay, so these are three important diseases which you need to know in case of subepithelial deposition. Okay, subepithelial deposition. So now next one you come towards intramembranous deposition. So within the membranous, intramembranous. So in intramembranous disease you need to remember basically 3-4 diseases like dense deposit disease. Okay, this is intramembranous disease, dense deposit disease. Then you need to know glomerulonephritis related to endocarditis. Okay, so glomerulonephritis related to endocarditis. Then you need to know deep seated abscess. Okay, so these are the important things where you see intramembranous deposit. Then you have subendothelial deposition. Okay, you have subendothelial deposition. So subendothelial deposition, most important ones are MPGN basically class 1, and very much important is lupus class 3 and 4. So basically lupus class 1 was subepithelial deposition, and lupus class 3 and class 4 are subendothelial deposition. Okay, you need to know this. And when we talk about IF, lupus class 2 was mesangial granular deposition. Okay, mesangial granular deposition or mesangial granular deposition of immunoglobulins, and class 3 and 4 was basically coarse granular. 3 and 4 was coarse granular, here class 3 and 4 are subendothelial deposition. Okay, subendothelial deposition. Then you have basically cryoglobulinemia. Okay, so you have cryoglobulinemia. Okay, so these are important thing you need to know. Then basically come towards the mesangial. Fourth is mesangial deposition. So mesangial is basically here also IgA nephropathy, very much important in IgA nephropathy. And you have when we are talking about IgA nephropathy, Henox Sclein purpura comes there. Then basically you have lupus class 2. So lupus class 2 like IF. Okay, lupus class 2. Then you have C1q nephropathy, that is again like IF. Okay, and you can have other mesengoproliferative glomerulonephritis. So this is, and then you have all are basically again all can be seen in case of lupus. Okay, lupus class 3 and class 4. All can be seen in membranoproliferative glomerulonephritis type 3. Okay, membranoglomenonephritis type 3, and basically in glomerulonephritis related to endocarditis and deep-seated abscess. So these are this is basically EM finding. Okay, so you need to remember this all things. If you remember this table or whatever I said, which table I made now, so this, if you remember this much, your EM about EM related to your glomerulonephritis is over. Now just first, yesterday I talked about one table which was saying approach of light microscope where we see hypercellularity. So basically when their hypercellularity was either intracapillary or extracapillary, okay, or where there was minimal hypercellularity. And I said that intracapillary hypercellularity can be again diffuse type in case of membranoproliferative glomerulonephritis and post-infectious glomerulonephritis. Then I talked about that there can be focal intracapillary hypercellularity also, which is basically focal segmental glomerulosclerosis. Then I also said about that extracapillary can be crescentic glomerulonephritis. Then second I talked about IF finding can be linear capillary, then it can be granular mesangial, it can be granular capillary, or it can be basically all combining capillary and mesangial. And I talked about different type of diseases which will have this. And today I am talking about EM electron microscope finding. So just basically what I said, we have talked about everything. Now if you combine this all things है ना, और हर डिजीज को इन टेबल के हिसाब से कॉम्बिनेशन करके पढ़ोगे तो योर बेसिकली इन वन और अदर वे योर basic fundamental things or important things about glomerulonephritis is over. In fact इंडिविजुअल को आपको पढ़ने की ज़रूरत भी नहीं है, बिकॉज आप अपना theoretical part इंडिविजुअल के पार्ट के बारे में now you can make by your own. So basically so these three are very very important things, and with these three tables or with these three graphs or with these three tables you can basically make out, or you can basically know or diagnose any type of endocarditis, okay, sorry, any kind of glomerulonephritis, okay. So that is important. Or you can just now make your own theory regarding each and every diseases very easily, okay. So basically this is what about the basic concept. So आपको ये concept आ गया, आपको glomerulonephritis बहुत easy हो जाता है, बहुत easy हो जाता है, ठीक है. So now come to some of the images. See here. So this is the image of a glomerulus, ठीक है. Yesterday as I said, so this image, this is a pass, okay, ये pass है, और ये आपका basically Jones methamine silver stain है, ठीक है. So now basically important stain के बारे में भी आपको पता होना चाहिए. So this is your pass stain and this is your Jones methamine silver stain. Now this pass stain basically what it is showing, this open loop, okay, this all are the capillary loop. So this all are the capillary loop and this is the basement membrane, okay, ये आपका basement membrane दिखा रहा है, ये आपका basement membrane दिखा रहा है जो भी pass positive होता है, ठीक है, that is pass positive. And all these cells inside the capillary loop, so this all are the endothelial cells, okay. And basically this capillary loop और ये ऐसे आ रहा है तो ये mesangium है, ये mesangium है, ठीक है. So but mesangium 1 to 2 cells they are normal, okay. 1 to 2 cells in the mesangium is the normal thing, but more than 3 cells in a mesangium is abnormal, that is called hypercellularity, okay, mesangium में. But you need not know exactly image में तो कैसे दिखेंगे, you need not know that, but at least theoretically you can know that if there are more than 3 cells you call it as a mesangium, okay. Then as I said, it will have a vascular pole. So see, this appears to be a vascular pole. This appears to be a vascular pole. यहाँ पे ये vascular pole जैसा appears हो रहा है. ठीक है, vascular pole में as I said there will be juxtaglomerulus apparatus. So juxtaglomerulus apparatus, which is basically formed by extraglomerular cells, by the juxtaglomerular cells, and by your macula densa. Macula densa. Okay, macula densa. We also talked about yesterday that juxtaglomerulus apparatus basically is responsible in case of hypovolemia or hypervolemia, that is maintaining the osmolality of the urine fluid. Okay, so that is important. Now this another picture is again showing same thing, and here you can see this is basically your juxtaglomerulus apparatus, this is your urine side. Okay, and this all open up are capillary loops. Okay, these are all capillary loops which have mesengium and which have basically your endothelial cells. Okay, and this is basically your Bowman's capsule. So this is the basic structure of a glomerulus. Okay, so now again normal glomeruli, this is again showing normal glomeruli. So this is again a juxtaglomerulus apparatus which will have glomerular cells, cells of Lecce, and macula densa. Okay, macula densa, macula densa. So that you need to know. So this is basically a DCT. ये आपका DCT है, ठीक है. So now again this is a glomeruli with mild, this is mesangial, basically hyalinization दिख रहा है यहाँ पे, hyaline globule दिख रहा है. So basically little bit of mesangial sclerosis is occurring. Otherwise this is a normal mesangium. Okay, so normal glomeruli. Again this picture basically it is showing you ये silver Jones methamine silver stain है, and this is basically a pass stain. This is basically a pass stain. See here, this basically ये capillary loop है, यहाँ पे ये देख रहा है ये this is a capillary loop, this is a capillary loop, and this capillary loop है. अब ये exact structure ऐसा ही है ना कि basically exact structure अगर ये capillary loop है और ये ऐसे mesangium की तरफ आ रहा है, ठीक है. So here you have mesangial cells and this is capillary loop. So exact structure है. So this mesangial cells have been increased here. So this is basically hypercellularity, mesangial hypercellularity, or what I say is intracapillary hypercellularity. इसी को कहता हूँ मैं intracapillary hypercellularity. Okay, so this is basically hypercellularity which you can see over here, and here you can see this methamine silver. These are the podocytes. So these are the visceral epithelium. So this is parietal epithelium with visceral epithelium or podocyte. Now here you can see lot of sclerosis, hyalinization बहुत ज़्यादा दिख रहा है और nodule जैसा दिख रहा है. ये एक nodule, this is one nodule, this is another nodule. Okay, so you can see the nodule formation, and this type of nodules they are formed in diabetic nephropathy. So okay, one thing you need to know about diabetic nephropathy, there will be formation of nodules. So this is basically increases cellularity, mesangial cellularity has increased and formed as nodules. So diabetic glomerulosclerosis you can see, and obviously this basement membrane. So these are the basement membrane. This basement membrane are thickened also. So there will be thickened basement membrane, that also you can see in diabetic is nephropathy. Okay, diabetes nephropathy. Now another important thing which you see in glomeruli is basically your duplication of GBM. So glomerular basement membrane, again this is a John silver stain, and John silver stain will stain the basement membrane of glomeruli and basement membrane of this what we call it Bowman's capsule. So when here you can see the basement membrane of glomeruli is here, you can see two membranes. So this is basically duplication of glomerular basement membrane, and this is known as also tram track appearance. Okay, tram track appearance, and this tram track appearance or duplication of GBM, this mostly occur in MPGN. Okay, so this basically mostly occur in MPGN. Now this duplication basically, see this is a capillary loop. Okay, so this capillary loop undergo duplication. So why this duplication is occurring? Because of interposition of the mesangial cell. So mesangial cell will come here and they will interpose here. So they will interpose along the circumference. So okay, they interpose coming between the subendothelial. So coming between the subendothelial cells and the basically your visceral epithelial cells. Okay, so that basically when mesangial cell comes between the subepithelium and the visceral epithelial cells, subendothelial and visceral epithelial cells, and so this space is formed, and that is, this looks like a train track. Okay, so this is, we call it tram track we call it. Okay, so basically this occurs because of the interposition of subendothelial cells. Then obviously you can also see spikes on the basement membrane. Okay, so spike on the basement membrane can be seen very well by Jones silver stain. Okay, so this is seen in membranous glomerulopathy. Okay, so this is seen in membranous glomerulopathy or membranous glomerulonephritis. So that is again important thing, and that is again MCQ asked in your exams. Okay, then again one other MCQ which is asked is wire loop. Okay, so wire loop is basically here you see thickening. So here basically you can say that cellularity have been increased, and there is also thickening of this membrane. Okay, so thickening of the glomerular capillary loop. Okay, glomerular capillary. So here you can see here this also thickening. यहाँ भी ये thickening दिख रहा है. So this thickening basically of capillary loop. So here slight thickening is occurring in capillary loop. So this thickening of in capillary loop is basically your wire loop. Okay, this is called wire loop. Okay, this is called wire loop. That you need to know. And obviously this is showing adhesion. Adhesion is also like focal segmental glomerulosclerosis. Adhesion can be seen. So very focally segmentally it is occurring. Okay, this other part of the glomeruli is more or less normal. Then we talk about crescentic glomerulonephritis. So crescent is basically, as I already said, crescent is formed by your parietal epithelial cells. Okay, proliferation of parietal epithelial cells, and crescent is basically said when it is greater than 2 cells in the Bowman's space. So in the Bowman's space, if more than 2 cells there are formed, then that is known as crescent. Okay, that is known as crescent. So see here, this is crescent. So this is crescent. So this basically this is your Bowman's capsule. So this pinkish color, and this Bowman's capsule, this had to be space. So यहाँ पे स्पेस है, जैसे ये Bowman's capsule है, इसके बीच में स्पेस है, but here this space is obliterated, and hence this is called crescent. Okay, so crescent. So this is also crescent, this is also crescent, this is also crescent. So in crescent what you get, you sometimes get disruption of Bowman's capsule. So here see your Bowman's capsule have thin out, and here more or less it is disrupted. So Bowman's capsule disruption you can get, and this is basically your fibrinoid necrosis, or this is basically your fibrin deposit. Okay, so this is fibrinoid necrosis you can see in this case. So you have cellular cast. Cellular cast means your mesangial cell or cellularity increases, okay, more than 2 cells, and basically there is deposition of fibrin. Fibrin का deposition भी होता है, that is cellular cast होता है. ठीक है. Then another is fibrinous cast or fibrocellular cast, fibrous crescent. Okay, so crescent can be cellular crescent, fibrous crescent, and fibrocellular crescent. Okay, 3 types of crescent. So fibrous crescent, fibrocellular crescent, and basically your one is cellular crescent. Okay, so basically in fibrous crescent there will be fibrocellular proliferation also. So there will be fibrous proliferation, and in fibrocellular there will be cellular and fibrous, both will be proliferating. So this is our crescentic glomerulonephritis. Okay, when we talk about crescentic glomerulonephritis, we see crescent basically extend outside the capillary wall. Now these are the images which will show you some of the IFs. Okay, IF, immunofluorescence part. Now basically here you can see this these all are the capillary loops. Okay, these all are the capillary loop, and this capillary loop basically having, this capillary loop is basically you're having IgG. This is for IgG, sorry, this is for IgG, and these are fine granular, so they are fine granular GBM. So in the capillary loop. Okay, capillary loop, and somewhere you can see in mesangium also. Okay, so basically when I say, so suppose this is a capillary loop, this is a capillary loop, and here you can see in mesangium also. So but this is a fine granular, not a fine granular type. Okay, granular to granular, but very fine. Okay, this is very fine. So this basically type of picture which is in fine granular glomerular basement membrane, deposition of IgG you see in membranous glomerulonephritis. Okay, now again come this side. So here you cannot, these are not fine, basically these are coarse granular. Okay, and this is a capillary loop. See, this is a capillary loop, this is capillary loop, and some of this region can be mesangium, some of these regions are mesangium. So this is basically coarse granular GBM deposits, and along with this capillary loop and this mesangium. So this is like एक smooth road आपका चल रहा है. Suppose you are traveling in the road, this is road. Okay, and here it comes a speed breaker, a bump. So basically this is called hump. This is called hump, and this basically is seen in post-streptococcal glomerulonephritis. So this type of immunoglobulin deposition that is mostly post-streptococcal glomerulonephritis has IgG deposition. Okay, even finely granular membranous glomerulonephritis also have IgG deposition. So this type of deposition, lumpy bumpy deposition is seen in case of post-streptococcal glomerulonephritis, and this is a classical IF of membranous glomerulonephritis. Okay, so coming back to another type. So here what you are seeing, so here one thing you are seeing, that is basically there is deposition. These are linear deposition, so these are linear deposition, but there is a little bit of mesangial deposition over here. So linear deposition, but linear deposition is again very thick. Okay, so this is broad segmental GBM deposition. Again, this is very thick type of deposition. Okay, so this type of deposition occurs in basically your this is granular deposition, but the deposition is basically granular. Okay, and this is occurring in lupus. Okay, wire loop type of deposition in lupus nephritis. Now come to this side. So this is basically, see, no, more or less the capillary loop are not this, but this mesangial region. So mesangial region, there is deposition of mesangial region, and this deposition is basically granular. So this and these are seen like branching tree. See, this is an branching tree, एक ट्री की तरह ब्रांचिंग ट्री जैसा दिख रहा है. सो दिस इज बेसिकली सीन इन केस ऑफ IgA नेफ्रोपैथी. ओके, IgA नेफ्रोपैथी, यू सी ब्रांचिंग ट्री ऑफ मेसेंजियल डिपोजिशन. ओके, सो दिस इज अगेन इंपॉर्टेंट इमेज इन केस ऑफ IgA नेफ्रोपैथी. Now again see this. Now basically you can know very well that these are the capillary loop. Okay, and these are the capillary loop, and they are more or less linear type of deposition. Okay, linear. So this is linear GBM deposition and linear capillary loop GBM deposition. ये किस में दिखता था? It is seen in anti-GBM. So it is seen in diabetes mellitus. It is seen in diabetes nephropathy. Even in dense deposit diseases can be seen. So here you can be anti-GBM disease. Okay. In dense deposit disease, what you can see is basically you can also see dense deposit disease. It is C3 with deposits, not immunoglobulin, rather C3 deposits more, and this also is more or less linear type of deposition. Okay, this is linear type of deposition. So we see this type of deposition in C3 in dense deposit disease. So this was about the IF of different diseases. So this much if you know about the IF of different diseases, you are done with your exams. Okay, you are done with your exam. Now coming to the electron microscope. So when you say electron microscope, so this is your basement membrane. See, this is your basement membrane. Okay, and as I said, this is your endothelial cells. Okay, this is inside the basement membrane, endothelial cells. Okay, these are your podocytes. These are your podocytes. This is your podocytes, and podocytes food processes. These are the food processes of podocyte. Okay, these are the food process. This is podocyte. Okay, so this basically you need to know in case of. So this is the capillary lumen, and this is the urine side. Okay, this is the urine side. Okay, so now see the image there is a difference in this both images. So this image have food processes, but here the food processes are lost. That is effacement of the food processes, and basic occurrence of or loss of food processes. Where do you see? You see in minimal change disease. Okay, so this is basically minimal change disease, EM of a minimal change disease. Then again you can see these are the basement membrane. Okay, so basement membrane, this basement membrane have thickened to great extent. Okay, normally basement membrane which is around 250 to 300 or 350 nanometer, so here it is around 184. So this basement membrane have thinned out. Okay, so this thinning of the basement membrane basically is seen in which case? So it is seen in basically thin glomerular basement membrane syndrome. Okay, thin GBM syndrome, or you can also thinning of the basement membrane in Alport syndrome. Okay, now come to the another. So here see again this basement membrane are thickened. Okay, so this basement membrane has thickened, and the size is nearly around more than 650 to 760 nanometer. So this thickening of the basement membrane basically is seen in case of diabetic nephropathy. Okay, so this thickening of the basement membrane is seen in diabetic nephropathy. Now again other thing is subepithelial new GBM. So sometime what happens? So here this is the basement membrane. Okay, ये आपका basement membrane है. So this is all, this complete is basement membrane. So these are especially then your endothelial cells, and this side you need to have podocyte, but you have the instead of podocyte a new membrane is formed. So this is a new membrane, this is a new membrane, and here you have podocytes. Okay, these are the food process of podocyte. So basically a new membrane is formed between this basement membrane and basically podocyte. Okay, so this is subepithelial new membrane formation you can see, and these are all the form cells. These are the form cells. Then you can also see basement membrane. This is a basement membrane which is laminated, and laminated basement membrane is seen in Alport syndrome. Okay. Then subepithelial deposition. So this is again same thing. Subepithelial, you can see in collapsing glomerulopathy. So this is again now see microtubules deposition. So here you see big large microtubules. Here you can see small microtubules. Okay. So big large microtubules, basically they are immunotactile glomerulonephritis, basically greater than 25 nanometer. Okay. So big large microtubules, and obviously in cryoglobulinemia the microtubules are less in size. Okay, very small. Then another microtubule deposition disease is basically fibrillary deposition disease and fibrillary glomerulitis and amyloid fibrils. Okay, in amyloid fibrils is basically 6 to 10, you can say 6 to 10 nanometer of these microtubules, and in fibrillary glomerulitis it is basically 15 to 25 nanometer. Okay, so that you need to know in case of fibrillary. Then coming to the subepithelial deposits, so basically this is the basement membrane. Now by now you know very well to see the basement membrane. So this is the basement membrane. Okay, and obviously here you have food processes which have more or less effaced out, and basically before that there is some deposition in the subepithelial region. So these subepithelial deposits, or these are called humps. This basically occurs in post-streptococcal glomerulonephritis. Again, see, these are the basement membrane. So this is the basement membrane, and here you can see these all are the subepithelial deposits. Okay, subepithelial deposits. Along with the subepithelial deposits, you can see spike also here. So this basically is subepithelial deposition GM spike, which is seen in membranous glomerulonephritis. Okay, so this is membranous glomerulonephritis, and this is post-streptococcal glomerulonephritis. Now again coming to the another images. So another image is basically, so here you can see mesangial deposits. Okay, there you can see mesangial deposits. So mesangial deposits basically occurring in IgA nephropathy. Okay, mesangial deposits are mostly occurring in IgA nephropathy. So here again you can see this is your basement membrane, and this is a subendothelial deposition. So whenever there is subendothelial deposition and subepithelial deposition, so then in that case, so this is a basement membrane. Okay, then in this case what you have it is basically subepithelial subendothelial deposition can be seen in different diseases. Okay, so combined diseases which can also be seen in like your both like lupus or MPGN 3 type 3, you can see all these. Okay, then one more thing you need to know is tubulo-reticular structures. So tubulo-reticular structure, so this is basically in response to the interferon. So this is tubulo-reticular structure, okay, and this basically is in response to your what you call it, in response to the interferons. Okay, then it's mostly seen in HIV patient, okay? HIV associated nephropathy. Okay, now HIV associated nephropathy, you know very well there will be collapsing glomerulopathy in HIV, collapsing glomerulopathy. But now the new questions can be said regarding the tubulo-reticular structures. Okay, tubulo-reticular structures most commonly seen in HIV associated nephropathy. Then you can in amyloid, you can see these are the electron microscope, and you can see like fingerprint. Okay, so this fingerprint which are known as Chrogg's thumbprint. Okay, so this Chrogg's thumbprint are seen in lupus nephritis. Okay, this seen in lupus nephritis. So fingerprint deposits are seen in lupus nephritis. Okay, so this again is structure which is showing reticular deposits. So this is tubulo-reticular inclusion. So this is basically seen in HIV. So this is basically seen in HIV associated glomerulopathy, which you see to reticular pattern, and also you see along with reticular pattern you can see basically in HIV you can see two things, that is tubulo-reticular structure you can see, and collapsing glomerulopathy. Most common type of is collapsing glomerulopathy. Okay, so with this images and with this much of information, now I think you are clear about IF, electron microscopic finding of different type of diseases in glomerulonephritis. Hope just go through this again and just go through your Robbins. Okay, आपके Robbins को एक बार पढ़ लो, and basically each and everything are given in your Robbins. आपके Robbins में ये सब कुछ दिया हुआ है. Okay, you can just read, and we'll talk about each entity now. So basically we'll talk about like post-streptococcal, we'll talk about according to our tables. Okay, so जैसे उस table में पढ़ाया गया था, and that will help you. Okay, so this that will help you very well. Now before signing out, I'd like to say you that you can basically what you can do is you can now subscribe to our channel. You can subscribe to the YouTube channel, and you can also subscribe to our Iconic. So you can be a subscriber of Iconic and basically your this Iconic segment of our Unacademy. Okay, so with that, what you can get is you can get 10% discount with my code Anil Live. So you can subscribe with this Anil Live code, and you can just also please hit the bell icon for the notification. All the new we provide you provide notification for all new videos which will be coming in coming days. So, and also you can also join our Telegram community on Unacademy Telegram community. That will also help you to come in direct contact to us. Okay, so you can contact us directly. So please subscribe our channel, YouTube channel. Thank you very much. Have a great day. So we will again come today evening. We will be joining together at around 7 p.m. for different glomerulonephritis in another channel, that is Unacademy NEET PG subscription channel. Okay, so Unacademy NEET PG channel, YouTube channel, we will be doing there about the glomerulonephritis and all. So we have done these all things previously also. Here we have done more better way. So just try to read this again and try to see note out the important things from this class. Okay, so very important class. The material is very essential and very good. Obviously, if you know this much, basically you are done with glomerulonephritis. You don't need to read any other things about glomerulonephritis. Okay, you don't need to read more details about this. Quickly we'll go tomorrow with different types of glomerulonephritis, and in the evening class also at 7 p.m. basically I'll be starting where I left. Okay, so basically that will be not I didn't leave here. I have already done some of the glomerulonephritis over there. So basically that thing you can get in this class, in next class. Okay, thank you very much. Have a great day and see you today evening.